Hi, my name is Bradley. Today I'm going to be talking about integrated activation of posterior tibialis. So, first off, it's important to consider any sort of neuromuscular pathologies you may have and or cardiovascular pathologies that could prevent you from performing this exercise. In addition, it's important to consider past injuries that you may have and or injuries that may be induced by the exercise. So important to consider those first, but I will be talking about integrating posterior tibialis into a integration exercise that involves other muscles. And integration exercises are important because there are no muscles in our body that work solo, meaning there are no muscles in our body that work by themselves to perform a certain movement. All muscles have synergistic muscles that aid in the movement. In addition, when we're doing integration techniques specifically, almost always we have our core muscles that are helping us complete those techniques, and you'll see that I'll be standing here and you won't be able to perform any sort of standing movement without your core muscles engaging at least a little bit. So for this, we're going to be doing 3 sets of 10 to 15 with a 1 to 2 minute break in between. That 1 to 2 minute break is there to give your muscle a rest and give it a chance to, first of all, loosen up a little bit after drawing all that blood to the area. And secondly, we're trying to strengthen the muscle and the muscles around that area. We don't want to be abusing them to the point that we could see atrophy. So the rest is important, and don't ever neglect the rest when you are completing any sort of exercise. And we'll be doing 3 sets of 10 just because that's what studies show is the most beneficial as far as strengthening exercises. This can be done with weight or with body weight. It depends. I'll show you 2 variations. So I'll just get to that now. So what I'll be doing is I'll be standing against the wall, and I will be essentially performing a calf raise, but I'll be inverting my foot, and I'll show you that now. So what I'm going to do is I'm going to stand against the wall, and I'm going to use the wall as support. And this can be performed with 2 feet or 1 foot and kind of just propping 1 foot up. But essentially, to integrate the posterior tibialis, we first need to target its 2 main actions, which are plantar flexion and inversion. So to really integrate posterior tibialis, we're going to invert the foot, and then we're going to go into plantar flexion. And this will allow us to integrate the posterior tibialis into a calf raise. And so I'm doing the 2-footed variation here. So I'll do 10 reps, and I'm going to hold at the top, come down slowly, back up. And that's going to allow me to activate my posterior tibialis along with my gastrocnemius. So the gastrocnemius here is working along with the posterior tibialis to push me up into plantar flexion and lower me into dorsiflexion. And the soleus plays a role in this as well, but more so if we were sitting down. That's 8. And you can see here, I'm using the wall to stabilize myself, which you can use as well. Otherwise, you can just do it standing straight up. It makes it a little bit more difficult. You have to tighten your core, which I talked about earlier. So I think that was 10. And another version, depending on the strength level of everyone, obviously this is dependent on your strength level, but you can do a single leg version, which is a little bit more difficult because you still need to invert the foot, but then you can just do it on one leg, and it requires a little bit more balance. Like I don't even know if I can do this one without touching the wall. But we can integrate the posterior tibialis with those exercises. And integration is important just because muscles don't work alone, and so we want to strengthen that muscle along with the synergists of that muscle for the action that that muscle performs. So in this case, inversion and plantar flexion with that dorsiflexion on the eccentric. And so a calf raise is perfect for activating posterior tibialis along with the muscles that aid posterior tibialis in its functions.